So my name is Farid Hakim. I'm an orthopedic surgeon at Southeast orthopedic specialist. My specialty is the trauma. I see patients for joint problems and sports medicine problem, but most of the patients that I see come to see me for the fracture care. I listen to patients. Give them time. So that's in the office. And when it comes to surgery, I provide them with the best technique to be able to get the best result possible. The most rewarding part of being a physician, and in our case, orthopedic surgeon, is to see your patients smiling and getting their life back. And when I see them going back to their daily living activities, to their sports activities, for me, that's my reward.
What is the most rewarding part of being What is the most rewarding part of being a physician? How does your training in fracture care set you apart?
I have the chance to train in a major trauma hospital in Montreal during my residency. And I think this is where I found that. This is a field that I really belong to, and can't find the word.
Okay, we'll come back to that question, okay? It's okay, we'll come back to that question, okay? What exercises do you recommend to patients to avoid future fractures?
So recommendation in general is to stay fit, stay within boundaries of weight that are acceptable. I do personally recommend to a lot of my patients to stay fit and to do some yoga classes and stretch, hydrate, as well as use the protection gears intended for each activity. A lot of patients coming. We still see a lot of patients coming because they didn't have any protection. Healthy living. That's what I recommend.
The advice in this would be to stay healthy, stay active, work within a reasonable range where the protective care is necessary. Okay. What kind of benefits does a patient get? When they come to what makes SOS a unique practice?
Southeast, we're a group of physicians, and I'm gonna say physicians because we're not only orthopedic surgeons. Southeast, we're a group of physicians that we're always looking to give the best for our patients. Each one of us is in the top percentile of their specialty in the city and even in the state. And I think this is what the patient gets when they come to Southeast. During my training in Montreal, it happened that I rotated in a very busy trauma hospital. And I got in contact with a lot of trauma cases, and that actually was the trigger for me to go into that specialty.
What do your patients typically see you for?
My patients see me for different type of fractures. I do see patients for joint problems and sports problems, but most of my patients see me for fractures. That could go from upper extremity to lower extremities, and I should have stopped there probably.
That's fine, we can cut it.
Okay.
That's fine, we can cut it.
Okay.
Can you talk about a patient that impacted your practice?
I can't think about one patient. For me, all my patients impact my practice. Every single one. And for me to see the result, and see them getting back together, put the pieces together, get them back to life is very rewarding.
What can patients expect from you?
I spend time with my patients. I listen to them when I'm in the office. When it comes to surgery, I give them the best surgical technique surgical technique, the best instrumentation.
All right, take a breath. All right, take a breath. Count to 3.
Just think how I'm gonna word the. Okay.
What can your patients expect from you? What can your patients expect from you?
I listen to my patients. And I give them time. When it comes to surgery, try to get them the best experience. They can get. As you know, patients are always nervous to go to surgery. Sometimes their first surgery. They're very anxious. So the key is to comfort them and to get to the surgery, and then to give them the best surgical results possible.
What is the most rewarding part of being a physician?
The most rewarding part is to see your patients get their smiles back, and go back to their daily activities, and to their jobs without pain, with full function.
How does your training and fracture care set you apart?
I happen to have been trained in a very busy trauma hospital. For me, this is what gave me that knowledge, and that experience to be able to treat any type of trauma case that comes my way.
What kind of benefits can a patient see when they come to SOS?
At SOS, every single one of us is an expert in his own specialty. We provide the patient with expert opinions and treatment and surgeons. We provide the patient with the whole treatment that include imaging, physical therapy, brace, medication. Patients do not have to go after they see us to another place and then another place. We give them all this in one place.
It's good. Let's do that one more time just for tempo's sake.
The last question. Okay. Is that okay to say one-stop shopping? Or it's not shopping? I recommend.
Maybe just mention that it's comprehensive. Musculoskeletal care, something along those lines.
Okay.
Yeah. Saying one-stop shop isn't wrong. But it's also.
Yeah, it doesn't sound good. It sounds like a business.
Yeah.
Yeah.
What kind of benefits will a patient get by coming to SOS?
At SOS, the patient get expert opinion and treatment. One of us is an expert in his own specialty. And we provide a comprehensive musculoskeletal.
That's okay.
Comprehensive musculoskeletal care. What did you tell me?
Care. Oh, we can just start from that. We also have the second thought, since we nailed the first portion about it. So it's just talking about the practice itself.
Okay.
And the practice provides with complete care to the patient that includes physical therapy, imaging, bracing, medications, and that I think is important because the patient do not wasting their time going from place to place where everything is given to them in one place.